Order. I give the call to the honourable member for Blair.
Thank you, Mr Speaker, and congratulations. Well done, Milton. In 2019, the Morrison government cut back the areas of Australia where overseas trained doctors and doctors in the bonded medical program can practice. This change contributed to the GP crisis we've witnessed in our nation. It meant that in regional areas, particularly on the fringes of our capital cities and major provincial cities, there will be trouble for GP practices recruiting GPs as older GPs retired. I spoke with medical practices in rural Walloon, in Riverlink Shopping Centre in Ipswich Central and in Corona Downs in outer Brisbane, all of whom were anxious and troubled by this decision. Now, the new distribution priority areas defined areas of Australia which allowed overseas trained doctors and bonded medical program doctors to access the MBS and therefore practice in those areas. And the modified Monash model is how the federal government defines location: city, rural, remote and very remote. M1 is the major city classification, MM7 very remote. It's MM2 areas, regional areas within 20-kilometre drive of a town of over 50,000 residents, places like Ipswich, places like the Somerset region, even the Corona Down region in Brisbane in my electorate, which was so adversely affected by the decision of the Morrison government. Now, with the support of local doctors such as Dr Catherine Hester and Dr Tony Bayliss in the Colleges Crossing Family Practice and so many other local doctors, I started a campaign straight away to have the Morrison government overturn this tragic decision. I could see adverse health outcomes for hard-working families and battling individuals across Blair, which already had 50% of GPs who were non-Australians. With the support of the Darling Downs Primary Health Network, the Westmoreton Hospital and Health Service, and indeed, Mr Speaker, you, as a member for Oxley, I wrote to the Regional Health Minister, the member for Parkes, on the 7th of August 2019, asking the government to reverse the decision and make an exception to the changes. But, unfortunately, he wrote back to me on the 23rd of the 9th, 2019, saying unless there's a dramatic reduction in the number of GPs employed in my area, a substantial drop in health outcome services for my region, there would be no change. I wrote again on the 8th of January 2020 asking him to reconsider the decision. He wrote back again on the 10th of February 2020, saying that the Distribution Advisory Group endorsed the current methodology used to determine DPA status. I wrote again on the 30th of March 2021, talking about the idiocy of the current changes that he'd made, which had impacted so adversely, cutting rural towns in two. I wrote to the minister inviting him on the 10th of June 2021, and I wrote again to the new minister, the member for Lyons, on the 27th of July 2021. Labor initiated a Senate inquiry into this area, talking about the critical lack of doctors access in regional areas across the country. Mr Speaker, I made 4 speeches in parliament urging the government to change on the 15th of October 2019, on the 6th of February 2020, on the 12th of August 2021 and on the 9th of February 2022. I urged in this place the government to change their decision. We made a commitment on the 4th of February saying if we get into government, we will make the change by designating regional centres such as those classified in MM2 areas as DPA for the purpose of GPs. On the 22nd of July 2022, I thank the minister for making that change. More than 700 areas in full or in partial got that change in classification, including in my area and in your area, Mr Speaker. GP practices now in exceptional circumstances catchment areas MM1, outer metropolitan, and MM2 areas only in Ipswich, in Kilcoy and Woodford could get access to GPs in these circumstances. And GP practices with an election commitment in MM2s and other selected catchments in Lowood, Rosewood and Springfield to Redbank could get access. Now, this is about the Albanese Labor government being concerned about regional health outcomes in a way that those opposite who pose and preen and posture in this place about supporting regional Australia fail to do. That history of correspondence and speeches in this place show that the Morrison government had failed to look after regional Australia in terms of health outcomes, and in my area, and it's only the election of a Labor government that made the difference in terms of health outcomes in regional Australia.
It almost been